talking about it's hard to talk about this in a vacuum of what's going on. And Patrick, I was reminded by this of he's talking about his friend, the veteran. Keep in mind, this same thing is happening to the Veterans Administration. 83,000 people are being cut from that. You mentioned the Agent Orange, something that I worked with, and the representative helped pass a very significant piece of legislation, PAC Act, and implement it. There's cuts to the PAC Act that are coming with that. Pile that on to the families that are talking about these children. They are gutting the supplemental nutrition program, the SNAP program, and the summer EBT program that adds food. Here in Minnesota, we feed our children breakfast and lunch at school. But when they go home for the summer on holidays, they don't have it. So think about the issue of their health care in general, the services they're getting. Compound that now that you're taking away the services that provide food or housing, or the special impacts that happens with veterans who have that care that can only be delivered at the VA. And we do it in partnership. So these types of things that were thought about for decades and stacked on together, I think it's really important. They have been very clear about this. There's been no report written on this. There's been no data. These are unelected officials, some of them 20, 21 years old, that decided they were going to cut these programs. I agree that you shouldn't have to be out in the streets, but I'm also going to encourage you to do it because, damn it, this is wrong. This is wrong the way it's going. You can talk about efficiencies, but no one has yet shown me. And again, I tell you this, Medicare and Medicaid and these programs have about a 2 or 3% overhead. Nobody in the private sector is able to deliver it at that amount. They deliver it with that efficiency. Can we do better? Sure. Sure, we should continue to do better. But when did we throw out 95% good to try and fix 5% that's not? And we're falling into this trap. And I think it's really important, again, for folks to ask their neighbors and understand this. And the one with senior care, those of us who have parents that are getting to that age, if you think we're in a crisis now for senior living, especially in rural Minnesota, cut Medicaid and find out what happens. Where are they going to go? Where are they going to go? So, good question on this, Jeremy. I would say those are threats even without them doing this, that the situation is that dire as it is. They're not crying wolf. It's going to happen. And I ask Minnesotans and the panel, they gave you a good indication of what would happen. If you're going to make these types of decisions, you have to picture what's it look like afterwards. And what you're talking about is something that we fought for decades not to have, the poverty in the streets, that our seniors not getting the care they need, the homelessness that goes on top of it, hunger. And it's all, again, I want to congratulate this of refocusing us. This is all unnecessary. And again, it's a bait and switch on efficiency. It's a bait and a switch on we need, we've got fraud, waste, and abuse. Certainly, we can always work on those things. But the portion of these really great programs and to totally throw them out, and I'm just going to name this, there is no one that's doing this that has any expertise whatsoever. They have no damn idea what they're doing. They don't listen to people who know. I don't know this like a doctor knows it. I don't know it like someone who's experienced these programs as much, or the experts who do it. But if you're an elected official, you have a responsibility to learn it, to use the data, and then talk about it how it really matters. So it's pretty catastrophic. And I am in absolute agreement of this, of the way they talk to us. We are already in crisis in our healthcare system. If this what underpins so much of it. And if you, again, the crisis in the long-term care and in senior living, it would blow the bottom out of it. And I can't imagine we're a state that provides more, does more. There's got to be states that rank on the bottom of this that I don't know what they're going to do.